Perfect. Okay.
Trishna, who will be moderating the session?
Dr. Shiv will be starting the session first, and then he'll just go with the event flow, ma'am.
Okay, Dr. Shiv, yeah?
Yeah.
Okay. So I
Yes.
just told
Yes.
Priyanka that Ramadan for us, so we break our fast at around 6 o'clock. So if it's okay that I excuse myself at 6 o'clock around it.
Yes, that
Thank
is absolutely fine. We'll also be trying to structure it like this. We'll go with your sections first during the panel as well. So that you, but if if it's time for you and if you wanna take some time off, please feel free to do so. Yeah,
thank
of course.
Hi
Thanks.
everyone, good morning, good afternoon, good evening from wherever you are. I'm glad to be part of this panel. Please, I'd already spoken to ensure that my sections come up a little early. In Cameroon, we're having some network issues, and I had a prearranged some prearranged things I had to handle before the invitation came. Thank you very much, and looking forward to having a pleasant time with everyone on board. Thank you.
Yes, thank you, Dr. Mafoko. And we've also arranged your session immediately after here. So Lekha will be leading the segment where you're speaking. Yeah, so we hope to also have your session done in time so that you're free to move as well. So Trishna, we can wait for another 2 minutes, and then we can go live. Okay.
All right, absolutely.
I think everyone has not joined. So how is the flow going to happen? Those who have joined, this flow will go accordingly.
Um, so ma'am, we'll just take this 2 minutes to also check. I think most of us are here.
Okay.
Um, yeah, most of us are here. We are missing two people, I guess. Tia is here as well now. Trisha, can you just check if in the speakers we have anyone else who's not there? As I see Julie, I can see Dr. Mani, Dr. Monica, Dr. Rua is here, and I also see Dr. Zainab, Dr. Virginia,
Dr.
Dr.
Chris-
Mafoko.
Dr. Christine is joining right now. Yeah, I can see she's trying to join. And I'll
Perfect.
just check quickly if anyone is left out. Just give me a moment.
That would be great. Yes.
Hi.
Hello, Dr. May.
Yeah. Hello. Hello, Dr. Emna. Emna. How are you? I can see my president here, MWI. Good evening, ma'am. How are you?
Hello, my dear sister. How are you? Happy Women's International Day for all of you. Happy to be with all of you.
After Cairo, we both are meeting here now, first time.
Yes, yes, yes. I am in New York for now. It's still morning. Hi, Dr. Zainab. Hi, everybody from Wewa and everybody.
President, how are you? Hello, everyone.
Hello, my dear
It's good
sister.
to see you
Hi,
all.
everyone.
Happy to
Happy
see
Women's Day.
everybody.
Happy Women's Day. Mhm.
Happy International Women's Day. So happy to
Yes.
meet all of you, lovely ladies, great ladies from New York. It's still early here, 9 o'clock in the morning in New York. So happy to see all of you, all the
Happy to
great members.
So it's time to start the session today. So we will go live in 3, 2, and 1.
Right. So, good morning, good afternoon, and good evening to all of you joining from different corners of the world today. And we know that today is the International Women's Day. So, on behalf of the World Medical Association, Junior Doctors Network, and our Gender Equity Task Force, it's such a pleasure to welcome you to this very special inaugural panel on women leading healthcare. We are going to discuss about how women are shaping the future with purpose, power, and digital impact. And what better day to come together than the International Women's Day? A day to celebrate women's achievements, but also to remind ourselves that there is still a lot of work ahead, because the gender equity isn't just a goal that we talk about, but it's something that we build on every single day. It's something that we need through leadership, collaboration, and courage to be built upon. We're also joined by an incredible group of speakers and leaders today. I'm honored to welcome Dr. Julie Beck, who is also the chair of associate members at the World Medical Association. We have with us Dr. Amani, who is the president of the Medical Women's International Association, Dr. Meg, who is the president elect of the Medical Women's International Association. We have with us Dr. Zainab from Nigeria. We have Dr. Virginia from Zimbabwe join us. We have Dr. Mafoko, who is also the president for the Women's Association in Cameroon. We have Dr. Rua, who has joined us from Saudi Arabia, and Dr. Monica Kaushal from the Emirates, Pediatric and Neonatal Society. We also have with us Dr. Christine Sadia, who is the president of the Kenya Medical Women's Association. Each of these women who have joined us today is a powerhouse, leading change in her country, amplifying voices, and inspiring others to rise. We are so fortunate today to have their wisdom and energy guiding this conversation. Over the next hour and a half, we'll be exploring some powerful questions. How do we turn uh, digital tools into platforms for empowerment? How do we mentor and uplift the next generation of women leaders? How do we make sure that equality in medicine isn't just an aspiration but the norm? It's also to encourage everyone tuning in to join actively, share your reflections in the chat, your experiences, and your hopes, because this session isn't just about listening, it's about connecting, inspiring, and moving forward together. Towards the end, we'll also unite in a shared pledge, a small but significant commitment to keep pushing for inclusion and equity in medicine everywhere. So as we begin, let's hold on to what this day truly means. It's more than celebration, it's a reminder of the generations before us who fought for the rights and representation, and a call for all of us to continue shaping a future that is equitable and full of opportunity. Thank you all for being here, for showing up, speaking up, and leading with purpose. To open today's session, I now call upon Dr. Hia, who will also share with us the purpose and the work of the JDN Gender Equity Task Force. Over to you here for the next time.
Thank you so much, Shiv, for this an amazing initiative. It's a very important today because even I would like to begin with this. This year, the United Nations places strong emphasis on justice because we need to recognize right now that unfortunately we still having some disparities and gaps for the gender equity at the end. So United Nations right now, they try to advance in gender equity, and we need to strengthen rights and ensuring that the women everywhere can fully exercise their legal and social protections. And for sure, in WMA, that's why we started become a part of the Gender Equity Task Force of the Junior Doctors Network. So this is a strategy initiative aimed for strengthening gender equity within in the global medical community, but within in JDN itself. So it composed with me, with Shiv, and the other JDN members, and even alumni like Pablo, Leta, and Leka. And this task force, we are working in the pillars for try to have a framework focus on visibility and communication, evidence, and generation and internal evaluation. For example, training, capacity building inside to the JDM, but for sure with a gender perspective. That's very important. So that's why that even in some of our pillars, we have the intention to work with the WHO, with the United Nations Women, with the other externals as well, and for sure with our amazing women inside to the WMA. So this task force also aims to promote women's leadership in medicine and contribute institutional outputs and policy discussions. So we also would like to do not only this webinar, we for sure would like to do more webinars with a gender perspective in other topics as well, but always try to focus with gender perspective. So thank you so much, Shiv, again. So let's start with this amazing panel because we have an amazing speakers, and I'm very happy to see all of you. Thank you so much for joining to us. Thank you, Shiv.
Thanks, Hia, for that fantastic overview of what we do as the Gender Equity Task Force panel within the JDN. Now it's time to hear Ms. Latika, who is also the Associate Vice President of Planet, our digital partner today, to share with us how women are leading in the space of healthcare entrepreneurship. Over to you, Latika.
Thank you, Shiv. And hello, everyone. It's truly a pleasure to connect with such an inspiring group today as we celebrate the spirit of women shaping the future of healthcare. This gathering is not just about marking a day on the calendar, but to acknowledge the resilience, leadership, and innovation that women continue to bring into healthcare ecosystem. Before we begin, I would like to warmly welcome each one of you to this meet and greet, where we have the opportunity to share experience, exchange ideas, and celebrate the journeys that are collectively transforming healthcare across the globe. Women emerging in healthcare entrepreneurship represents a powerful shift in how we approach healthcare innovation and leadership. What inspires me the most today is witnessing women across healthcare landscape emerging as entrepreneurs, innovators, and ecosystem builders. Women entrepreneurs are addressing some of the most pressing challenges in healthcare. They're inspiring the next generation of healthcare professionals to think beyond traditional pathways and become leaders who create meaningful impact and become torchbearers for emerging sectors that are defining how healthcare knowledge is shared and applied, shaping a healthier future for communities worldwide. Well, this International Women's Day, I find myself reflecting on a journey that began with a simple but powerful vision to create a value-rich ecosystem for medical professionals where doctors across the world could learn from each other, share knowledge, and collectively improve patient outcomes in their respective countries. 9 years ago, this idea took shape through Clearnet. Building this ecosystem has been a journey of intent, passion, consistency, and patience. Like many other entrepreneurial paths in healthcare, it required persistence, belief in the mission, and the courage to keep building even when the path was uncertain. Over this 9 years, I have learned that building in healthcare is not just about creating a platform. It is about building trust, nurturing a community, and enabling the collective wisdom of doctors to flow across borders. When medical professionals collaborate, the real beneficiaries are the millions of patients whose lives are impacted by better informed care. So, as we celebrate women who lead, innovate, and inspire, I remain grateful to every doctor, partner, and colleague who has been part of this journey so far. Well, the mission continues to strengthen global clinical collaboration and empower doctors with knowledge and community they deserve. Here's to more women building, leading, transforming healthcare for better. Cheers, and thank you so much for having me today.
Thanks, Latika, and more power to women who are leading in healthcare entrepreneurship. Now we have Sazi here with us to introduce our distinguished women leaders who have made the time to join our panel today. The floor is yours, Sazi. Please go ahead.
Thank you so much, Shevin. Good afternoon to everybody else, and a very happy International Women's Day. My name is Sazin Zoma in South Africa, and my job is quite simple, and that is to introduce to you all our distinguished guests today. It is a pleasure to see you. If we could have their profiles, please, displayed, and I will go through this quite rapidly in the interest of time. Based on the fact that I am from the World Medical Association, it is only fair that I start by introducing the powerful women that lead my organization. First and foremost is Dr. Jacqueline Kitulu, who's the president of the World Medical Association. Dr. Kitulu is an executive with executive leadership experience spanning over 15 years. She's currently serving as the president of the WMA. And during her career thus far, she has held multiple key roles in leadership, including the chairperson of Rocket Health in Uganda, the director of Emergency Plus Medical Services in Kenya. She was actually the first deputy, she served as the first deputy governor to the Kenya Red Cross Society and the president of the Kenya Medical Association, the national chairperson of the Kenya Medical Women's Association. And her knowledge and skill over the years has advanced healthcare structures, steering and transformation in both national and international landscapes. She's a strong advocate for women in leadership and youth leadership in the healthcare industry. Dr. Kitulu's work in bridging gaps in the private sector and public sector healthcare sector medicine is well known for cultivating laudable results in these areas, strengthening health systems, leading governance, and policy transformation, and advancing the universal healthcare coverage globally. Our second speaker is Dr. Julie Baquet from France, is current chairperson of the associate members at the World Medical Association. This distinguished specialist in emergency medicine and family physician, as a healthcare leader with contributions to the global health in governance, policy guidance, and transformation. She currently leads the associate member body of the World Medical Association and has led and contributed in executive leadership roles, including the French Medical Council, the European Society for Emergency Medicine, and the International Federation of Emergency Medicine. Dr. Baquet holds vast experience in development and governance of junior doctors globally and still continues to serve as an advisor for the World Medical Association's Junior Doctors Network. Currently based in France, she works with a team of emergency medicine physicians providing emergency medical and critical health services. Dr. Amani Asfour, the current president of the Medical Women's International Association, and a prominent advocate for women's empowerment, scientific research, and healthcare leadership in Africa. She has held several key roles, including the Secretary General of the African Society for Scientific Research and Technology and a founder of the African Pediatric Nephrology Association. She has led multiple regional and international organizations supporting women in business, science, and healthcare, including the African Alliance for Women Empowerment and the African Business Council. A strong advocate for women's financial independence and STEM education, Dr. Asfor has worked extensively to promote gender equality, entrepreneurship, and intra-African trade. Her contributions have earned her numerous international awards and recognition. Dr. Ruwa Al-Harathi is from the Saudi Society of Dermatology and Dermatological Surgery, is a distinguished dermatologist and healthcare leader with significant contributions to clinical practice, scientific advancement, and medical education. She is the co-founder and vice president of the ADAM Academy and the president of WCD 2031 Riyadh BID, promoting global dermatology collaboration. She also serves as the vice president of the Saudi Society of Dermatology and Dermatological Surgery and the CEO of Avant Clinic in Riyadh. Since 2013, she has been a consultant dermatologist at Security Forces Hospital. And Dr. Rua is a general director of scientific programs at MEIDAM Association and a renowned international speaker, trainer in aesthetic injectables, a key opinion leader supporting innovation and evidence-based dermatology. Dr. Monica Koshal, Secretary of the Emirates Pediatric and Neonatal Society, is a highly experienced neonatologist with over 28 years experience in pediatric and neonatology, including 20 years in the United Arab Emirates. She currently serves as the chief of the Department of Neonatology and was a former medical director of the Emirates at Emirates Specialty Hospital. Previously, she has served as the chief of pediatrics and neonatology at the Zuleika Hospital, where she established the first level 3 neonatal intensive care unit in an Emirati private hospital. Dr. Koshal is the vice president of the Emirates Pediatric and Neonatal Society and the president-elect of the neonatal chapter of the IAP in the UAE. An active academic, journal editor, and conference faculty member, she holds several prestigious qualifications, including an MD, DM Neonatology, FRC, PCH, and FNNE. Dr. Mankandini Meg, the president-elect of India for the Medical Women's International Association, is the current national president of the Association of the Medical Women in India and a distinguished leader in obstetrics and gynecology. She has served as chairperson of the ICOG, FOGSI, and the past president of the IFUMB, a past dean of the Indian College of Medical Ultrasound as well. She's a member of the FIGO, the FIGO Committee on Infections During Pregnancy, and the AOFOG Reproductive and Sexual Health Committee, formerly the Deputy Director of Health Services and at the government of the Maharashtra. She has received numerous honors, including the Dr. Ganatra Award, the Mahila Gaurav Puruskar, and Global Leadership Awards in Healthcare. She's also a very sought-after speaker at national and international conferences, and it is an esteemed pleasure to have her with us today. Dr. Zainab Kwaru Muhammad Idris is the current president of the Medical Women's Association of Nigeria. She is a distinguished public health physician and the president of the Medical Association's Women's Association Nigeria. With over 15 years of experience in public health leadership, she has led impactful programs in reproductive, maternal, newborn, and child health, nutrition, and healthcare systems strengthening. She currently serves as the program manager for the World Bank supported Accelerated Nutrition Results in Nigeria project in the Kaduna State and is also a lecturer in community medicine at the Kaduna State University. A fellow of the West African College of Physicians, Dr. Idris is widely recognized for her contributions in policy development, capacity building, and improving community health outcomes across Nigeria. Dr. Mafoko is a biochemistry graduate and medical doctor with a strong passion for advancing the health and well-being of women and children. Her commitment to improving maternal and child health led her to become an active member of the Cameroon Medical Women's Association. She's also a dedicated pediatric HIV and AIDS mentor, supporting healthcare professionals in strengthening care and treatment for children living with HIV. Through her work, she advocates for better healthcare access, mentorship, and capacity building to improve healthcare outcomes for vulnerable populations across her community and beyond. Dr. Virginia Masunda is a senior medical executive and public health leader in Zimbabwe with over 3 decades of experience in healthcare governance, occupational health, and clinical leadership. She serves as the regional medical officer for the eastern region of the National Railways of Zimbabwe, overseeing healthcare delivery and multidisciplinary clinical teams, while also running a private practice since 1994. Dr. Masunda contributes significantly to Zimbabwe's early HIV response, supporting the rollout of antiretroviral therapy and training practitioners in same. She has extensive governance experience, and her leadership role at the CBZ Life Assurance, and currently serves as the president of the Zimbabwe Women Doctors Association, connecting with global women medical leaders. And lastly, but certainly not least, Dr. Christine Sadia, the president of the Kenya Medical Women's Association. Dr. Sadia is a public health expert and currently serves as the president for the Kenya Medical Women's Association. With over 3 decades of experience, she has been a strong advocate for women's empowerment, gender equality, and human rights. Dr. Sadia has held several leadership positions and founded multiple national and regional women's professional networks. She's a member of the WHO Africa Region Family and Reproductive Health Technical Advisory Group, and previously chaired the Governance Working Group for the Medical Women's International Association, contributing financially significantly to governance reforms and global health initiatives across Africa. It is an absolute pleasure to be in your presence, in the presence of such powerful leaders, women leaders, on Women's Day on an international platform. Over to you, Shiv. Thank you so much.
Wow, what a panel, Sazi. And I can't wait to hear them all. Now, for our attendees today, stay tuned, because for the next 60 minutes of amazing discussion that's going to happen on how women are shaping the future with purpose, power, and digital impact, we are joined by my fellow Gender Equity Task Force members, Pia, Alileta, Lekha, and Sazi, who will take us through different segments of the panel discussion today. With that being said, I'll now invite Hia to convene the panel into its first segment. Over to you, Hia.
Yes, thank you so much. And let's start first with the Dr. Amani Asfo, the President Medical Women's International Associations. And I would like to do the first question from you, Doctor, please. My question is, from your global vantage point, what landmark milestone best represents the transformative impact of women in medicine, and what would you say made the breakthrough possible?
Thank you very much. First, let me congratulate all of you for today. Happy Women International Day from New York, where we are attending the CSW, Commission of Status of Women at the UN, and the main theme is access to justice. So it's really about access to women's justice, whether economically, politically, socially, in health. And so as Medical Women International Association International President, I am so glad to be with all of you. All of you know that Medical Women International Association has been established since 1919. So it's already the global organization that have more than 50 countries under umbrella of MEWA. And I am very glad to greet here my great women MEWA president-elect, and MOA member presidents from Nigeria, from Zimbabwe, member from Cameroon, and all of you. I am so happy to be with very important Young Women Doctors Association and Medical Women Association. So my dears, thank you very much for your very important question. And I really believe that from a global perspective, one of the most important landmark milestones demonstrating the transformative impact of women in medicine is the shift of women from being primarily seen as contributors within healthcare systems to becoming the architects of those systems as clinicians, researchers, educators, policy advocates, and leaders shaping national and global health agendas. For many years, women were central to care delivery, yet underrepresented in decision making. The real milestone now has been the growing recognition that women not only strengthen healthcare through service, but through leadership, innovation, and system reform. Today, women physicians and health leaders are influencing maternal health policy, advancing gender-sensitive research, expanding access through digital health, leading professional associations, and I am very happy for my sister now leading the World Medical Association, and also driving more equitable models for care. This reflects a profound transformation in the healthcare itself. What made this breakthrough possible was not actually one single event, but the convergence of several forces. First, the persistence and excellence of generations of women in medicine who proved that their value despite the structural barriers. Second, stronger global advocacy for gender equity, which really pushed institutions to recognize the health systems perform better when women are included in the leadership. Third, collaboration through professional networks and associations such as Medical Women International Association, World Medical Association, and all those networks that really created those platforms. Actually, as MOA, we have several clusters and several committees, and so it really works on for mentorship, for solidarity, for visibility, and again for policy influence. The growing understanding that women's health must be addressed across the life course is not as a niche issue, but as a global development, human rights, health systems priority. And this is actually strongly aligned with the broader vision of advancing women's health equity, innovation, and advocacy. So for me, really, the landmark milestone is that women in medicine are no longer asking only to be included. They are actively shaping the future of health. And that's actually why we chose the triennium theme for the Medical Women International Association. It's about promoting and advancing women's health to realize the Sustainable Development Goals. As you see in my background here, we have the SDGs, the 617 SDGs, which we believe that women's just access to justice and health and promoting is very necessary to realize all the 17 goals of the SDGs, because ending poverty, you need a healthy life. You need a healthy woman. Ending hunger, again, we need access to health for women and her family. Access to health actually is one of the core issues for all of us. And again, it's really about gender equality. It's about quality life on land, life on underwater, access to equality. All the 17 goals and global partnership will not be achieved except by realizing health and women's access to justice with reference to the health. So I believe that this gathering, thank you for the organizers, is very important to bring all of us from different parts of the world. I can also recognize Dr. Rauya from Emirates, from Saudi, and Dr. from Monica from Emirates, and Dr. Gazelle from Young Junior Association. I mean, all of you together, coming from different parts of the world, from different diverse institutions, are very important to realize our real women empowerment. And I always say that women empowerment is the cornerstone for realizing the SDGs. So happy to be with you here today, and happy Women International Day.
Thank you, Doctor. Then my next question for you is what emerging area of healthcare transformation do you believe that women are uniquely positioned to lead?
So, my dear, I think looking ahead, I believe women are uniquely positioned to lead the transformation of healthcare at the intersection of digital health, equity, and person centered care. Healthcare is moving rapidly towards digital platforms, artificial intelligence, telemedicine, data driven decision making, and more connected systems. But technology alone is not actually the transformation. True transformation happens when innovation is guided by human needs, ethics, access, and inclusion. Women leaders are especially well positioned here because they are often bring a systems perspective, one that connects clinical care with family realities, community health, prevention, education, long-term well-being. That kind of leadership is essential if digital health is to reduce inequities rather than deepen them. I also believe women can lead in redesigning the healthcare around realities of women's lives across the life cycle, including reproductive health, mental health, chronic disease, caregiving burdens, and access challenges in underserved settings. In many parts of the world, women physicians understand firsthand how social determinants, culture, and policy affect health outcomes. This again gives them a unique ability to shape more responsive and inclusive systems. The concept note rightly emphasizes digital transformation, community led engagement, system level change, and ethical innovation. Very important to put 100 lines under ethical innovation. And these are precisely the areas that women leadership can be most impactful. In particular, also, I would like to highlight three areas. First is digital health and telemedicine, especially for underserved and remote population. That's also why we are, for instance, as you mentioned, one of my hats, plus Africa Medical Women International Association is African Alliance for Women Empowerment and Health and the Africa Business Council. So we're trying to see how we set up centers for maternal health, for radiotherapy, radiodiagnosis, and to have telemedicine and teleradiology, so we are able to serve women in the remote population. Second, ethical AI and data equity, ensuring that new technologies serve women fairly and safely. Third is integrated models of care, where physical, mental, reproductive, and social health are addressed together rather than in silos. So the future opportunity is not actually simply for women to participate in healthcare transformation, but to lead it with purpose, power, and vision, ensuring that innovation remains equitable, compassionate, and globally relevant. I think on Women's International Day today, we celebrate not only how far women in medicine have come, but also the responsibility and opportunity to have to lead in the next era of healthcare transformation for benefit of all. And I believe it is very important to realize that for us, I have a strategy which I call it the triad of empowerment, which is about three pillars. First pillar is personal empowerment programs. How do we work together to empower women through education, through information, through capacity building, mentorship, and knowledge. Second pillar is about policy advocacy, how all of us here advocating for policies that empower women in health, empower women in decision making, and make sure that the policies give an enabling environment for all of us to serve not only our health career women, but again, the women who are in need of our services. Third pillar is partnerships. Nobody can do it alone. All of us have to come together to see how we partner with UN agencies, with institutions, with medical associations, with others, even with private sector, civil society, in order to make sure that we realize women empowerment. So the three P's, three pillars are very important to realize our objective of the real empowerment of women and access to justice, including health. Thank you and happy Women's International Day.
Thank you so much, Doctor. Thank you so much. And we are completely agreed that all these areas represent domains where women's leadership can profoundly reshape healthcare system for the better. Thank you so much. So our next doctor, Dr. Rua Al-Harithi, the vice-president of Saudi Society of Dermatology and Dermatologic Surgery. My question is, from a perspective of medical leader, what change have been the most important in enabling more women to move into leadership and decision-making roles in healthcare?
Well, first, let me say Happy International Women's Day to all from Riyadh, Saudi Arabia. I really would like to extend my sincere appreciation to the organizers for bringing together inspiring leaders to here. It's a privilege, really, to join such distinguished colleagues on this special day, a day that reminds us not only to celebrate the remarkable achievements of women in medicine, but also to continue working toward a future where leadership, opportunity, and impact are truly equitable. Now, back to your question. Thank you very much for this important question. And from a leadership perspective, one of the most transformative changes has really been the national and institutional commitment to empowering women. I will share our experience in Saudi Arabia. For example, we had the Saudi Vision 2030, which is led by His Royal Highness Prince Mohammed bin Salman. It accelerated opportunities for women across healthcare, academics, and leadership. Policies that support women participation, combined with investments in education and innovation, have created an environment where women are increasingly shaping decision making in medicine. So I agree with my colleague when she said, rather than just contributing, we are now the architect of that. Equally important has been the cultural shift toward valuing diverse leadership perspectives. We know that women has different leadership skills, and when they bring it into the institution, it really empowers and elevates. So when institutions move beyond representation to true inclusion, where women are actively involved in shaping strategy, research priorities, healthcare policies, leadership become more balanced, more innovative, and responsive to social needs. In my own experience in global dermatology leadership reflects this progress. Riyadh is bidding now to host the World Congress of Dermatology in 2031, which is the most important congress in dermatology. It's exceed 130 years of age, but yet has never been led by a woman. So if Riyadh was voted, and I would have the privilege of becoming the first woman president of this Congress, this would not only be a personal milestone, but also really a powerful symbol of how far women in medicine have progressed and how global collaboration can continue to accelerate that progress.
Thank you so much, Doctor. So, congratulations for this and amazing news. The lead women lead and Congress, and it's amazing and inspiring for the rest of the women in medicine that we are. But another question that I have for you, from your experience, what practical steps are most critical to ensure that the next generation of women in medicine can move from clinical excellence to positions of decision-making impact? I mean, from clinical to these positions.
Dr. Amani Asfour really highlighted the most important steps in a very well organized way. But what I would add maybe to that is to ensure the next generation of women in medicine move from clinical excellence to positions of impact, we must focus on three key actions. First, mentorship. Woman empowers women. Talented women need leaders who actively open the doors, create the opportunities for leadership and international collaboration. Second, we have to provide early exposure to leadership. Women clinicians should be encouraged to participate in policy discussions, scientific committees, global initiatives, so they can see themselves not only as a healthcare providers, but you're embedding into them early in their career that they are also decision makers and they can shape the future of medicine. Third, we must also leverage digital ecosystem and global network to amplify women's voices. Just as Dr. Amani said, today digital platforms allow women physicians from different regions to collaborate to share knowledge, and to advocate for change at an unprecedented scale. Exactly like what we're doing today. We are joining from different continent, different specialities for one mission and one vision. So when mentorship, opportunity, and visibility align, leadership becomes a natural progress. Our responsibility as current leaders is to ensure that the path for the next generation is not exceptional, but expected.
Absolutely, absolutely right, doctor. Thank you so much. And yes, thank you so much for both. I really would like just only to add that the one of the most important thing also is building strong professional networks as our name, Junior Doctors Networks, because networks across institutions, specialties, and countries allow women physicians to collaborate and share opportunities and amplify our voices. So this transition from clinical excellence to leadership for sure requires systemic commitment. As both of you already said, institutions must recognize that talent alone is not enough. So opportunity, visibility, and structural support are essential for women physicians to influence to the future end of healthcare. Thank you so much for both. I would like to invite to Leica, Dr. Leica, for the next segment, the Embracing Digital Healthcare to Expand Our Reach and Global Collaboration. Dr. Leica.
Dr. Yazul, thank you. I'd like to invite Dr. Mafurko, who's president of the Cameroon Medical Women's Associations, with a question. Dr. Mafurko, in your work advancing the health and well-being of women and children in your setting, what practical example would you like to give that demonstrates how digital collaboration can empower the next generation of women doctors in your region and also worldwide, how we can apply it to other women doctors in similar or different settings? Dr. Mafurko.
Trisha, can you just check if Dr. Mafoko is able to
Oh,
connect?
Dr. Mafurko, she's here now.
Great.
Dr. Mafurko, hi, welcome back. I hope your connection is stable enough for the next segment. In your work advancing the health and well-being of women and children, what practical examples would you like to draw on from your experience that demonstrates how digital collaboration can empower the next generation of women doctors in your area of work, in your region, and how can we apply it to other similar settings as well?
Hi everyone, can you hear me?
Yes, we hear
Yes,
you
we can.
well.
Okay. I'm sorry, my network has been shaky, so I've been in and out. I was just trying to get some clear connection where I could talk. So from my personal experience in my work with especially with vulnerable populations in the Cameroonian society, currently we are actually living I'm in a region that is plagued by civil war for the last 8 years. And being from the minority group, as they always call us women, I've seen my fair share of discrimination as a young female doctor trying to actually climb the ladder. So the first thing that I tried to do while working as such was not just to gain recognition by demanding it, but I had to gain recognition by creating impact. So I started by working twice as hard as every other person and gained the recognition first of the local community. By virtue of my sustenance and by virtue of the work I was able to put in, I gained the recognition from first the hospitals where I was working with the directors, and that placed me in a position where I was able to start attending national conferences and be able to make rules that were affecting the Cameroon population when it comes to healthcare. Just because I was able to stand out as a female practitioner, not because I was a woman, but because I was willing to put in the work. Now, to be able to just having a social media platform is actually not something that would have helped me at the start of that career. So I had to join like-minded people, which was what led me to the Cameroon Medical Women Association. I began there as just a volunteer, and because I was persistent, I was insistent, and I wanted to actually make true impact where I was, even though I was just a volunteer at the start. From being a volunteer physician there, I started climbing up until I became the president of that esteemed association. With that, it brought me some international recognition as well, because I was able to now sit with other panelists from different places and give my own input and insight as to what was actually affecting the common man, and especially the woman and the woman and children in our perspective in Cameroon. I'll take, for instance, Clarinette did not just see me while I was just sitting at some place. I gained the recognition from partnering with Clarinette as the president of the Cameroon Medical Women Association. So if I'm going to be talking to fellow women physicians who are out there, it's not enough to just think that because you are a woman, it's just going to be handed to you on a platter of gold. First, you need to be able to make impact. Recognition does not come by demanding it. Recognition comes by actually working for it and creating an impact where people can actually know that you have something to offer. So I'll recommend my fellow female physicians who are coming in to actually be able to work on themselves, to make themselves useful, to be able to deliver something that the people need. Don't just be someone who just reads the handouts and does nothing else on the side. It's important to be innovative. Social media can actually give you some widespread recognition, but social media without substance equals to nothing. It's not enough having a Facebook page, a LinkedIn, uh, Twitter, or all of that. What are you going to put out there if you don't have the substance to give to the people? We are women, and we understand that demanding equity is something that has always been challenging in this society. But if we stand tall as the women and we actually have some substance to put out there, we invest in ourselves as women, we collaborate with ourselves as women, we actually empower each other and stand together as a united front, we can actually make a change and actually show forth that our skills are not just because we are women, but because we have the knowledge, the skill, and the technical know how to make a change. Thank you very much, and over.
Thank you, Dr. Mofurko. It's very inspiring to listen to your journey from how you started as a volunteer and are now president of the Cameroon Medical Women's Association. You already gave so many examples of how young daughters should first build recognize themselves within the community, or have their work recognize themselves and create impact. But a follow-up question, would you like to add something else if you were advising a young woman doctor such as myself or my colleagues over here seeking to build a presence in their community and also worldwide? What first strategic step would you recommend and why?
Thank you very much for that question. In a bid to actually build a recognition, my first strategic step I'll recommend to any young female physician is to actually create meaningful connections. Not just have people in your corner that are just going to applaud you for any flimsy thing you do, but have people who can actually look you in the face and tell you that you're right, you're wrong. They're able to give you good criticisms. So by creating meaningful connections, you have a chance to actually share innovative information and get skills that you may not have it's not everything that one person can have. So we can actually use a digital platform, be it LinkedIn, be it Facebook, be it Instagram, to actually create some meaningful connections with associations that are out there. There are so many women associations that are out there willing to actually help female physicians actually have a say in the society. So if I were to advise, the very first thing, if I were to advise anyone, is to create those connections that make you stand out, connections that can make you better, that can build you, that can give you a presence, and give you a chance to actually showcase that knowledge, that ability that you have to the society. And from those connections, you can actually see that you can grow and climb the ladder and be able to make significant contributions to the physician world out there. Thank you.
Thank you very much, Dr. Mafurko. Our next panelist, I'd like to invite Dr. Virginia Masumba, who's president of the Medical Women's Association of Zimbabwe. Dr. Virginia, welcome. Our
Thank you
question to
very much.
you. Thank you.
Hello. Yes, thank you very much for
Hello.
having me.
Thank you for
Hello.
being here. Hello.
Yes.
Our question for you is, how have digital health tools expanded opportunities for women clinicians in your context, and what untapped potential still exists?
Thank you very much for that question, because we really need digital tools in Zimbabwe. From a Zimbabwean perspective, digital health tools are beginning to reshape how women clinicians practice, lead, and access opportunities in the health system. However, the benefits are still uneven, and there remains significant untapped potential. How digital health tools have expanded opportunities for women clinicians. There's now greater flexibility. And we have problem of work-life balance. This society is mainly patriarchal. So women are meant to do the household chores, look after the children, and even the extended family. To the extent that, balancing work and life, especially when they start wanting to specialize, and working long hours, trying to study, it becomes very difficult. So if you can have digital tools that can actually help to balance the work and life, digital health platforms such as telemedicine, mobile health, and electronic health records, and artificial intelligence, and etc. can allow women clinicians to deliver care remotely with more flexible schedules. In Zimbabwe, many women doctors and nurses are finding it very difficult to balance professional work with family responsibilities. Teleconsultations and remote follow-ups reduce the need for constant physical presence in hospitals, enabling women to remain active in clinical practice even during maternity and caregiving periods. Remote patient consultations via telemedicine platforms, digital follow-ups for chronic diseases or maternal health, reduce travel time for outreach programs. That will also help and give them flexibility. It helps retain women even in the workplace, especially in urban centers like Harare and Bulawayo. Expanded professional learning and specialization can also be done on digital platforms. They have significantly increased access to continuous professional development and specialist knowledge. Some health workers are in quite remote areas, so coming to areas that are central, where professional development is being provided, can be very difficult. So if we have digital platforms, they can still continue doing their professional development there and receive specialist knowledge. Women clinicians can now participate in online medical training, webinars, virtual mentorship programs. Digital learning helps women advance professionally without leaving their jobs or families. I thank you.
Thank you, Dr. Virginia. for speaking to us about telemedicine, mHealth, and how it helps balance work life in your context. A follow-up question for you. What safeguards should be in place to ensure that this expansion of digital health does not unintentionally widen gender or geographic inequities?
Thank you very much for that question. As digital health expands, careful safeguards are necessary to ensure it benefits everyone. There should be investment in rural digital infrastructure. Currently, rural clinics often face poor internet connectivity, unreliable electricity, limited devices. We need to give them infrastructure to also be on these digital platforms. Without investment in connectivity, poor power supply and digital equipment, digital health could disproportionately benefit urban centers only. So those rural centers will actually be left behind. There should also be gender-sensitive digital training programs. Women clinicians, even nurses and midwives in rural areas, who are the custodians of maternal and child health, must receive equal access to digital training skills. Training should include digital literacy, telemedicine platforms, health data management. This prevents technology gaps between male and female health workers. I thank you.
Thank you, Dr. Virginia. It's very insightful how to balance gender and geographic inequities. Next, I'd like to call upon Elelita to lead the next segment on current systemic challenges. Over.
Thank you, Laika. I would now like to call on Dr. Zainab. As we go into these systemic challenges, Dr. Zainab, just confirming that you're with us.
Yes, I am. I've been waiting.
Yes.
All
All
I hope
right.
you can hear me.
Yes, definitely. Thank you. So yeah, talking about systemic challenges, of course, women's empowerment into leadership has made considerable strides from where we started and where we are today. But standing from where we are today, what would you say is the systemic barrier that most consistently is limiting women from their advancement into leadership?
Yes, thank you very much. Once again, a very good day to all participants, our panelists, and most especially to our international president, Dr. Amani, our team population of medical women. For me, it's a pleasure to be here as we gather not just to celebrate women, but to celebrate the power of women's voices, our compassion, and the leadership that we demonstrate. And as medical women, we know that our voices continue to heal, our hands continue to serve, and our hearts carry the hopes of millions of families across the globe and in communities and nations that we collectively serve. So coming back to the question that you posed, I think it's very important for us to recognize the fact that a lot of the times, excuse me, especially when you look at what is happening across the globe, women make up the majority of the workforce, the health and care workforce that we have. Yet leadership in health systems remains disproportionately male-dominated. In most of our countries, particularly the developing countries, women are increasingly visible as doctors. You get to see many young women going into this field, becoming specialists, becoming public health experts, researchers, you name it. However, when we look at what obtains in our hospital management boards, our policy decision spaces, our academic leadership, and health governance, women continue to be underrepresented. And this is not just in numbers, and also in terms of the mix that is required. This gap, again, is not simply about numbers. It reflects those systemic barriers that have been embedded in those institutions, in our professional culture, and even in societal expectation. From our experiences across clinical practice, we know that most of our professional associations, when you look at the various medical associations that we have, for instance, Medical Women Association of Nigeria, and our community programs, including the work that we do with various groups like the faith and cultural actors, we see clearly that multiple layers of barriers intersect to limit women's advancement and participation in leadership positions. So what are these key systemic barriers that limits women's advancement? First, we have the structural and institutional barriers, and these remain very significant, especially when it comes to leadership selection. The processes are often informal and influenced by existing networks, which historically, like I've said, is male dominated. Secondly, there are deep-rooted gender norms that influence perceptions about authority and leadership. In many of our contexts, leadership continues to be subconsciously, viewed and associated with masculinity. Thirdly, there's a gap in mentorship and sponsorship pipelines. I had the young doctor that spoke earlier on talk about her experience and how she was able to really come on board to fight some of these social norms. So one of the things that we need to do is to ensure that most of our women that are talented, that are qualified, that are already in the field, serve as mentors. So this lack, the women lack this wealth of individuals that can serve as mentors, and then access to influential mentors that can support their progression into strategic roles is often missing. And then we also have women frequently facing disproportionate work-life integration pressures. A woman that is a medical personnel, she is married, for instance, she has children, she has a home to take care of, and at the same time, she still has to perform professionally as a medical personnel. So these responsibilities, especially combined with the caregiving roles within families, continue to serve as a constraint. And then we have other systemic factors that combine to create what many scholars refer to as the leaking pipeline in health leadership, where women enter the profession in large numbers, but progressively disappear at higher leadership levels, and especially because of all these factors that I mentioned earlier. So how do these barriers manifest in real settings? One, institutionally, we see that these barriers become very tangible. In some hospital settings, women may constitute a large proportion of the clinical workforce, but they remain underrepresented in hospital management committees, in boards, or even executive leadership positions. In the academia, for instance, fewer women occupy professorial or departmental leadership roles, despite their strong representation among early career researchers. And then leadership opportunities are also frequently influenced by informal professional networks from which women may be excluded. You find situations where some meetings are held late in the night. So how do you expect women to be present in such meetings? So these are realities that continue to confront us. And then coming down to the grassroots, at the community level, our engagements, especially like I've said, through various networks like the faith and cultural leadership, the dialogue platforms, also highlight how social norms can shape perception of authority, including whether these communities themselves readily accept women in leadership roles. However, we also saw that when trusted leaders publicly affirm women's contributions to health and development, perceptions can actually shift positively. So this shows that institutional change and cultural transformation must happen simultaneously for us to really make an inroad in shifting those norms and the realities that continue to confront us when we look at those systemic barriers. Thank you, and over.
Thank you so much, Dr. Zainab. I'm seeing a lot of nods and thumbs up from our guests here. I mean, these are barriers that I think cut across for all of us, and they really hit home. Just building up on what you said, what, from your experience, which strategies have actually worked to address these barriers? And can we also adopt these barriers elsewhere so that we can address these issues?
Yes, I think we have to think along the immediate, the midterm, and perhaps long-term strategies that we need to deploy. I think when you look at the theme for this year's International Women's Day, it talks about giving to gain. And for us to give to gain, we must institute urgent measures that the shift will help us intentionally normalize women's leadership in healthcare systems. First, institutions must move from passive inclusion to us being deliberate with those strategies that promote gender equity in leadership. This includes transparent leadership criteria that needs to be set. It must be structured, our mentorship pathways must be structured, and then the workplace policies that support professional growth must be women-friendly. And then equally important is cultural transformation. Community norms, professional cultures, and leadership narratives must evolve to recognize that leadership in health is defined by first competence. It doesn't matter what your gender is. And it also has to have empathy and service, not just the gender perspective. And then professional bodies such as ours, the Medical Women's Association, we must play a crucial role. We must be the voice out there in mentoring emerging leaders, in advocating for gender equity, and then amplifying women's health and voices in health policy and governance. Ultimately, when we do that, advancing women in leadership is not simply looking at it from the gender lens, but as a health system strengthening imperative that we must all embrace. Thank you.
Thank you so much, Dr. Zainab, for those insights. I'll now move on to Dr. Monica. Just confirming that, yeah, I see you unmuting. So my question to you would be, from your experience, where would you say is the biggest gap between opportunity and access for women in leadership?
Thank you. First of all, my sincere thanks to the International Medical Women Association and the organizers for the kind invitation and for giving me this honor to be part of this important discussion on International Women's Day. And actually, many things have been already covered by Dr. Zainab. So I would be just re-emphasizing some of them. So from my experience working in neonatology, women from a large part of the healthcare workforce. So women are really large part. Today, I had posted a picture of Happy Women's Day from my pediatric department, from my neonatology department, and they were all women all over. And so it's not only the doctors I'm talking about, nurses as well, you know. So, and so when you talk about specialties like pediatric, neonatal care, women, they are the backbones of these clinical services. They bring compassion, they bring resilience and clinical excellence in the bedside every day. Having said that, when you look at senior leadership and decision-making roles, the representation of the woman drops significantly. And so the issue is not that the pipeline is less, the pipeline is actually full of talented women. The real gap lies in the access. So the access is mentorship, sponsorship, structure leadership pathways. And as Dr. Zainab rightly pointed out, the gap emerges during our critical career phases when woman is married and she has children and she's trying to balance professional growth and the family responsibilities. And I have seen people when they are recruiting the new doctors, they say, oh, don't bring the women because, you know, they will come with a lot of, you know, baggages, even for the grassroots sometimes. So the other gaps, I would say, which I would point is representation gap. So though we are forming the major workforce, but if you look at the executive board, senior leadership positions, we are less. And so we need to be representing ourselves much more than what we are really at the moment. Then come the sponsorship and the mentorship. So mentors, we still have increasing, and because when I become a leader, I try to mentor many of them. But the sponsorship, like that means the management they should be not promoting. They're not giving high visibility roles and decision making. They're not introducing women in the decision making committees. The structural and the policy gaps are there. So there's a lack of transparent promotion criteria or standardized evaluation metrics are lacking. So there is a little bit of bias which is coming into picture. And also, when we talk about women, we need to give them flexible work policies where that's not being given. So once they are, even if they're given any role, that flexible work-life balance policy is not there. And then many people pointed out about networking and access gaps. You see, networking inside the premises and outside the premises both make a very important role. And I have seen women often have a less access to this informal networks, and that really influences the decision making and career opportunities. They get fewer invitations to the strategic committees, research boards, and leadership councils. And then comes the cultural bias. I mean, many of the places there is a cultural bias. There is like a, what someone told, masculinity is as taken up as a leader, and they cannot see a woman being, giving them orders or something like that, and that's being the many women are rejected because of those, and uh, organizational cultures may undervalue leadership styles because usually women are more collaborative, more empathetic, and that's taken up as a weakness that she cannot take a decision. So that's a cultural bias. And then of course there is a training gap. When they want to send for a leadership training, they choose mainly the men. And then there is a gap in the visibility and recognition, like, to publicly recognize or rewarded as a woman. That I have seen being less in some of the places. So now I would say that when women who nurtures life at the bedside, they are empowered to lead the decision-making table, I would say that the entire healthcare system would become stronger. I was a medical director in the hospital, and I had like faced a little bit of these issues, and especially when you are a clinician and then you are into that role, then to make a balance, people need to understand that's important.
Yeah, thank you. I mean, you've really gone through a very exhaustive list of some of the access gaps that we see in our institutions pretty much daily. Just to follow up on that, what would you say that institutions can do in order to close that gap? And as they're closing the gap, how do we make sure that it's not just intention, there is real accountability behind it?
This is important. So the gaps which I've told, I would go through them to say, well, how do we fill them? So a practical step institutions can take is to build structural mentorship, sponsorship programs, ensure a transparent promotion pathways. When I say women should be given some position, I don't say that just because they are women, because they are having talents as well. So the practical way is, first of all, representation gap should be filled. That means you should make an extra effort to, and you should have a measurable targets to say that the women are going to be in the executive board, committee positions, and then there should be a regular track and report gender representation. Is it happening or not happening? Just putting in the paper is not the answer, Someone should be accountable to see that that really happened. And then you need to strengthen the sponsorship and mentorship. So women themselves should come forward to mentor the young doctors how to become a leader. And then some structural mentorship program should be created to bring them forward. And sponsorship programs, because even if you mentor, I am ready to become a leader. If I'm not being sponsored by the management, this is not going to happen. So HR, the management, they have to make ways how to improve the visibility, what projects they should bring in to bring the women into the leadership roles. And we need to have address structural and the policy gaps. So transparent promotion criteria should be there. I don't say that I'm just I don't qualify and make me one. No, but there should be checklist who can be, and if I am capable, I should be given. And then as a woman, This is very important. Flexible work policies has to be given. You need to give maternity leave. You need to give sometimes remote work, flexible schedules without penalizing the leadership trajectories. And equal opportunity should be given. And then we need to be always inviting them for any access or networking. Make sure you invite and don't make the timing so odd that the woman may not be able to join in. And but you should be inviting them for their board meetings, for strategic discussions. And of course, when we rear our children, we need to be emphasizing on reducing this cultural bias. So it has to start from there and it has to continue up front. So and to reinforce it, we need to have a unconscious bias training. So we should have a managers, leaders promotion who should not be culturally biased. We should start from there, and then we have to value collaborative and empathetic leadership styles. Call on when you see any. So we should, whenever you see any kind of a bias or inequity, it should be called on and penalized there and then. And definitely, time to time, we have to, like our HR should make sure, our management should make sure that there is an executive coaching, stretching the assignments, and training programs are in place. Whenever any woman achieves something, it should be really recognized and celebrated and acknowledged their accomplishment. And this is very important. And we should be sending them more and more. What she was telling, that I got the opportunity, one of the speakers said, to represent for conferences, to speaking out there. That gives you actually access to the outside world, as well as it gives you more confidence to deal with these situations. So I would say that this is very, very important, that we build compassion and collaboration. And when we empower our women to lead, the entire system will become stronger, more inclusive, and more innovative. This is what I think. And when the women lead in healthcare system doesn't just become more equitable, it becomes better. So it's not, I don't like calling equity, and I'm begging for my rights. What I mean, when we are in the leadership role, and if you see the New Zealand Prime Minister, the female, how strong and nice leaders we have. Like that, we have many of these examples where the women, when they become leader, they actually can lead the society in a better way. So that's my take on it.
Thank you so much, Dr. Monica. I'll now
to finish, I would say I'm lucky enough. I'm in an Emirates where our Emirates Neonatal Pediatric Society, the president is woman. So I was vice president. I am a woman, and we have another committee head. She's a woman. So out of 5, 3 of us are women. So I'm proud about it.
Nice. I'm seeing a lot of, yeah, the screens go off. Thank you so much, Dr. Monica. I'll now hand it over to Dia to take us through the next segment of policies and institutional opportunities. Thank you again.
Yes, thank you so much. It was a wonderful and amazing contribution for the doctor and for you, from you, Lilita. Thank you so much. For our next segment, that is a policy and institutional opportunities, I would like to ask to Dr. Mandaki Meh, President-elect India Medical Women's International Association. Is here?
I'm here. I'm very much here.
Great to see you.
I'm
Thank
here
you so
from the
much for
beginning.
being here.
I'm here from the
Great.
beginning.
So
Yeah.
yes, thank you so much. The question is, what is one policy or institutional reform that could meaningfully accelerate gender equity in medicine, and what will it take to move it from recommendation to implementation?
So, good evening, everyone from India. And I wish all of you a very happy Women's Day. I have my Medical Women Association president here. So, I'm really honored, Dr. Emini, that I'm here. And thank you for giving this opportunity. So, I think most of the things are already been discussed. But one policy I'd like to discuss here is that one of the most important policy reforms would be the transparent pay structure and the promotion criteria. Because as a woman and also in the health sector, in the administration, at the post of dean, deputy director, director, we all have faced a lot of resistance and lot of I can say that that negative impact in the promotion criteria, especially on the top. I must share with you that Maharashtra is one of the very progressive state in the India, but when it came to the post of chief secretary, which is the highest administrative policy maker, there no woman was given a chance, and they were all saying that they are all equal, but still they are not given a chance to become the chief secretary. This is a state of affairs in the very progressive state of Maharashtra, where I live in the Mumbai. Similarly, if you look at this, theoretically is all, it's okay. But then in India, looking at the promotion avenues and looking at the, job opportunities, now government has given since last, 1 decade, 30% reservations in the direct services. That is one of the very progressive policies, I can say. And in that 30%, though the policies there, again, I'll say that the policies are there, but again, the implementation is not there, to the 100%. So if there are policies which are very pro women, which are very pro medical professional and everything, even the economic reforms are there, they give loans to the women for, starting the practice and all those things. But still, implementation is very, very important. So what I would like to say here, so this is a one policy where I like to really, say that this transparent pay, even in the advanced, states or countries, I can say developed countries, 20 to 30% women, they have less pay as their male counterparts. I don't know about here in your countries, but we have seen that they are not paid that much as it is paid to the male counterparts. So, to filling this gap is very, very important. And that is how I will say that how we recommend this thing to in the implementation will be the leadership accountability. I think all my friends have said here that leadership is very important, and leadership will is very important. So here we have many women. I think India, you must have seen Indira Gandhi. Just now we have our president also, this women. There are many women leaders already in India. But now what we see that political will as well as the will of the government and bureaucracy is very important. Second thing is very important is whatever policies we make. In India, we have many policies of promotion. Then I just said that, economic reforms, helping the women as a micro, support for the this thing. And also we have the child policy. I think our pediatrician that we have crash wherever there is a working place, they have children. They can bring their neonate, their children, their thing. They have a working place, very, very conducive in atmosphere. Now they are creating, it is compulsory for everybody. If they are working women and they are lactating, they must have this one room where they can feed their children. Or so there are so many good policies which are there, but it should not become the hindrance. Like suppose maternity leave, as somebody has already mentioned, that maternity leave should be given. Even the medical termination of pregnancy leave should be given. Even now they are, coming up the ideas of the menstrual leave also. So there is a lot of hue and cry. You must have read in the newspaper, hue and cry. Now the menstrual leave is also being, just thought of. So anyway, we should not, by these laws and policies, should not become a hindrance, because they will not choose the women employee because she is getting so many leaves. So what I'm trying to say that this is there, the policy for the promotion should be in the place. And how we can again do is that I already said about the leadership accountability, then mandatory data. Data collection is very important. Suppose annually all the institutions should send the data of the gender gap, promotions, and also it should be there should be policy enforcement. Funding is very much required. I think so many people already talk about the research and the funding, and in the budget, in the annual budget is already going on in the March in our country. So there should be allocated budget for this, gender sensitive budget, I can say, that for the women medical students and for the hostel. So many women doctors are coming with, there are no facility for the hostel, there is not good atmosphere. So all this allocation, because there is no fund, so all this allocation bring very what I can say supportive, and making a lot of facilities for the, even for the medical students, postgraduates, and for the, even for the regular medical doctors, women doctors. It's very essential to have the good funding for this thing. So with this, I like to say that it is very, very important that as a mandatory system of transparent pay and promotion, and the in healthcare institutes could significantly accelerate the gender equity. Also, it should be provided by the regulatory requirement. I mean, there should be control, there should be audit, there should be feedback, and there should be standardized metrics and leadership accountability. Then only we can build this only one policy, that is of the promotion as well as of the pay structure. It should be equal. So this is my just say about the policy.
Thank you so much, Doctor. It's very passionate and inspired history and everything that you already said. So let's continue. Thank you so much with Dr. Christine Sadia, President of the Kenya Medical Women's Association. I would like to ask you the first question. Professional associations often play a powerful role in shaping healthcare policy and leadership pathways. From your perspective, how can such associations influence systemic change and expand leadership opportunities for women?
Thank you very much. Let me start by acknowledging those who have organized this, and particularly the Medical Women's Association International and CREMNET. Greetings, sisters and brothers that are here, and greetings to all women doctors that are in that platform. That question is very important, and I would want to piggyback on what Dr. Zainabu and Monica had said, because a lot of context they had laid very clearly what perhaps are the issues that we deal with when we are talking about those issues of policy and of leadership. And I think they have done an excellent job, and I would like to appreciate what they have said. However, I would look at the role of the associations in trying to level the playing field for women, especially women in medicine. A very complex situation where you do not want to be found wanting, you don't want to be given just because you are a woman. And therefore, when you go to the room, how do you light your room? How do the professional associations help women to light their paths and their journey and their room, so that when they get to leadership position, then they get to be signposted, and therefore no aspersion is cast on your leadership or credibility. I think it starts from two perspectives. One, the building of the agency of the woman in medicine, which is they have already talked about, like mentorship, overcoming the barriers, both the invisible barriers, and I think that is where the policy gaps are. The invisible barriers are embedded within the policies that may look very nice, but because we have not done clear gender, disaggregated gender analysis and intersectionality of how it would then works for women and men differently, then we find ourselves sometimes caught up by thinking that these barriers are just being imposed on us. It is that they are there. The policy may look nice on the surface, but we have not looked at them. Therefore, researching and coming with gender desegregated data, real situation that prevent women and that need to inform policy. So policies that are just done without clear gender analysis and policies that are not gender transformative may not work for women. Therefore, we need to begin to invest more into research and looking at the boardrooms then or the leadership in its own pipeline, whether from the lower end or the top range of leadership and the boardroom. What then stops the woman ticking in the boardroom? I think there are things that we need to do. Assertiveness is one of them that you need to build. Thick skin, women must have thick skin to be in a boardroom where it's male dominated. How do you shine in that room? And how do you maintain your credibility and tenacity and then ethics so that they can affirm you as one of their own? I think this is a journey that is very difficult to sometimes to go through. Those of us that have managed to climb those leadership ladder, we must confess that it's not an easy journey, but you need the professional association to back you up. Sometimes you need to have a shoulder to lean on. You need a mentor, you need a coach, you need somebody who has been there before to spotlight you and to help you when you are discouraged and to cheer you on. And I think for me, that is the role of the professional association that will help us do the barriers that Dr. Zainab and Monica had said in the policy shift. There are many policies that have been working, but women do not take advantage. Why? Because perhaps they were not cascaded and the environment is not suited for the person that they were intended to. Therefore, the outcome that they are influencing is not the same. You find very many women, we said that they drop out as they start from the lower end, dropping as they go up. What makes them drop? I think we need to invest more into management, research, governance, and leadership of women in medicine. And this is something that we are beginning at Kenya Medical Women to work on. What are the frameworks that we need for recruitment, for retention, for rewarding, and those like things? They are very invisible, they are hidden, sometimes they are toxic, and therefore that is where you find that we are talking about gender-based violence at the workplace. They may not be just you're just being violated, but emotionally you are drained. Then you find that you cannot cope. But the invisible labor also, because you have invisible labor, which is your reproductive gender roles that you also undertake. Sometimes that balancing act becomes very difficult. And sometimes women think that when you go there, people will appreciate that you have a child at home, you have a family, you are caregiver at home. May not be. In fact, maybe your downfall. So how then do you anchor yourself is the critical question that women that want to advance into top level leadership must and boardrooms must begin to think about. That it is a tough terrain, but it is not difficult. Women have done it. And even here we have seen Dr. Kitulu, who is here, who was the president for Kenya Medical Women Association at some point. I think FIGO is doing very well. I think holding each other's hand and learning and the network of professional association backing you and sometimes speaking for you when the boardroom become hostile and politics gets in. We should not be naive of politics, which is outside the health sector. And therefore, those structures and structural issues span out of the health sector, and sometimes we need to be looking out for them. I would not be, I hope that I've said the role that perhaps I see that professional associations should do. starting from building the individual, their capability, capacity, tenacity, and agency. But beyond that, they still need to stay on power, then depends on this association remaining to look at, to mentor you, to coach you, to look after your welfare, and to help you when you are in need. Because sometimes it is nasty, it can be a political nasty nightmare when it comes on you on top leadership, and you need people to rally around you and to just be with you and emotionally stabilize you. So thank you very much.
Thank you so much, doctors. Thank you so much. We are closing this segment, so definitely we need to learn, and we are learning that the gender equity in medicine will advance when policy, institutions, and leadership move from intention to implementation. For the next segment, I would like to ask to call to Sassy. Sassy.
Yes, hi. Thank you so much, Khesu. For this next segment, I'd like to ask a few questions related to the vision of empowering future women leaders. Dr. Bakay, as junior women doctors navigating the early stages of your careers, what is the one challenge you face that is often overlooked in high-level policy conversations?
Thank you, Sazi, for your question. And first, thank you, Shiv and the whole JDM management team for bringing together this exceptional panel today with very interesting discussion on this International Women's Day. And I'd like to mention that in my country, which is France, today is International Women's Rights Day, which is a very interesting nuance that the French have added to this International Day. And allows to reflect on how different it can be perceived and viewed. To reflect on your question, Sazi, you actually, in your question, highlighted both the issues that we women face when we enter leadership careers, is that we are not only women, we're young too. And this, in our environment, the leadership environment that is still quite dominated by men and often not the younger men. It's two features that we actually have as rather that are viewed negatively by the people we interact with. So in these instances, women have to prove twice as much of their capabilities, have to work twice as much to prove what they're worth of, what they have to bring to the discussion, to bring to the topic, and to bring to the global health sphere and to the medical practice. And young women have to prove it even twice because they don't even have the decades of experience to rely on which the overall management and administrative environment are expecting and relying on. So it's been quite a difficult way to navigate, but I have to be honest, in these instances, most of the panelists already addressed the issues and how to bridge the gap. And sponsorship, not only mentorship, but sponsorship is, to my views, the most important point that can help us go through, and also leading by example. What made me in a position to go further and break these stereotypes is that I have seen women in power. I have seen women in the World Medical Association, starting with Dr. Jacqueline Kitulu, who has been a strong support for the Junior Doctors Network from the beginning, but many other women in especially in the World Medical Association, but also in other organizations where I have been active before. And leading by example is probably the best gift that women can give to other women, especially when they're younger. You're muted.
Sazi, you're muted.
Thanks so much. Thank you so much for that response. What does meaningful mentorship for junior women doctors truly look like in practice?
It's a very interesting question, and the response is going to be several-fold. I think that mentorship and sponsorship, and I insist on sponsorship because mentorship is someone giving advices. Sponsorship is someone who is going to advocate for you, to open the doors for you, to give you the contacts you don't have, to bring the network to you. And that has been addressed also by many of the panelists before. It's about a network that is dominated by men and in which women have trouble getting in. And the sponsor is there for you to opening this network to you, to getting you in. And that is a first step. If you never get in, you never get to a leadership position. Then I have to say that organization we are active on, whether it be physicians organization or women organization or women in healthcare or women physician, these organizations are the ones that have a strong responsibility and also a strong power to advance young women leadership. And I have to highlight the example that the WMA and the JDN are setting today. WMA has just opened a work group on gender equality and gender representation within the WMA, based on the consideration that, as for now, gender representativity in the WMA leadership is not equal yet, but they are taking action on it. And the JDN has been fortunate and has the honor to be on that working group. And with this, the JDN has also launched the Taskforce. And that is a very strong step that the JDN has taken to address these issues. And I think this is also how mentorship and leadership and sponsorship happen. Last, but very important, before entering medicine, women are already in career, more or less. When they're in high school, we all know that women, girls, have better academic outcomes than men, boys. But still, they are not empowered. They are not confident enough to get into scientific career. Medicals, yes, medical school they are in most parts of the world, but the scientific career not. Leadership career even less. But this is because they are not empowered from the very young age. And I think that our role, even when we are all doctors and early or late career doctors, our role is also to go to the younger girls from middle school, maybe as early as possible, to show them that leadership exists for women and that we have a space and we have a role to play there, and that they may be their future too. And we are the ones who have to go there and nurture their confidence and give them the power as early as possible.
Absolutely. Absolutely. That's quite correct, actually, and on point as well. My final question for you is that if senior leaders in this room could commit to one concrete action this year to better support junior women clinicians, what should that be?
I would say that we are global leaders, but we are also physicians. All of us are doctors. And I would say that action starts the closest from home as possible. And it's the easiest action to take. They are actually close to us. It would be to go to med schools and set up a program, a sponsorship program for women, opening access to leadership careers, or it can be leadership in the global health, but also in the clinical sphere, where women are also underrepresented in some of the medical profession, in some specialties especially. OBGYNs are a lot of women, but surgeons are a lot of men. And this is also something that has to be addressed. It's not because the women are less skilled for surgery. It's because the burden of the work-life balance is more difficult to handle in surgical sphere. It's also because the surgical sphere is very male-dominated historically. And so if I could ask for the leaders to commit to something, it's of course to advocate for international programs to empower women and women physicians, but also start with the very little step that we can build up in very little time and effort, is to build sponsorship programs in our universities.
Fantastic. Thank you so much. And I think that's actually a very adequate reflection on what the next steps need to be in our lives and where we need to put our focus in terms of advancing women, advancing the agenda of women in leadership from grassroots levels all the way to international executive leadership. Dr. Bakay, thank you so much for answering my questions and thank you for joining us. I'll hand over to Shiv to wrap up for us this session and start with our closing remarks as we wind down on this webinar on International Women's Day. Over to you, Shiv.
Thank you so much, Sadly. Thanks, Julie. Thanks all the panelists for being here. And there are a lot of questions coming in, but in the interest of time, I'm just going to pick one. And if any of the senior members want to go ahead and take this up, you can do so. The question is, do you think the role of women in the community is becoming more important than their traditional roles at home? What do you think about that? And that is one of the questions which has received like maximum thumbs up. So if any one of you wants to take it up, please go ahead.
Did you ask me that?
I will. Okay, so I will like to answer this question, especially from the from Indian point of view, because we have very large communities, and the doctors, they are seen as more as a social worker, they are seen as a more educator, they are seen as a public health awareness program. So lot of our Medical Women International Association and I am the president of Association Medical Women in India. So our program parallelly goes for the health education in the community. You can see lots of on the website also, that lots of people, they are doing adolescent health, and they are doing prevention of this cervical cancer, breast cancer. So now the role of doctors are not only giving the health care or the medicine, but actually the in the community their role has become much larger, and the community also wants to listen to them, because not only they are their physicians or doctors, but they are, whatever they are telling, they follow. So I think doctors are really shifting their role from their own families or the concentrating. It is more in the community, and especially Southeast Asia, Indian communities. It is very well noticed, and it is very well, I think, documented also, how the doctors are becoming more in the community, and they are giving a very positive impact in the society by their physical presence itself. So that is my say regarding this.
Thank you. Thank you so much, ma'am. And I must say, what a fantastic discussion we've had today. Thanks to each of our panelists who brought their immense experience and thoughts to this forum today. I now request all the attendees, panelists, and my fellow Gender Equity Task Force members to join Kezul and myself for a unified pledge advocating for gender equity in medicine. The purpose of this pledge is not a one-time commitment to some set of ideas, but a gateway into the long-term dedication to the cause of advocating for gender equity in healthcare at all the levels and in all the areas. I request here now to lead us through this pledge. Yeah, please.
Can you hear me, everyone? Thank you so much for this and amazing. No? Okay. Thank you so much for this and amazing webinar. I really learned a lot, and I'm very happy to hear to all of you and very motivated, and also makes me think that one of my remarks that I would like to say first is that absolutely today is not only a moment to recognize our progress, but we can reaffirm our commitment to ensuring that the women in medicine have an equal voice. And of course, probably it not happens in the whole world, but it could be the best that the women in medicine have an equal voice and opportunity and leadership. So the pledge, well, the first that we already have it is we commit to actively advancing women's leadership in healthcare by ensuring that women are represented, supported, and heard in decision-making space across clinical practice, research, policy, and global health. So I would like to invite the rest of the members of this amazing gender equity task force to continue with this, for try to get involved and be more active in this webinar. Leica, would you like to continue, please?
We'd like to also commit to mentorship and sponsorship, to commit to mentoring, sponsoring, and uplifting the next generation of women in medicine, starting early as well, as Julie mentioned, creating pathways where young women clinicians can grow with confidence, opportunity, and visibility. Elelita?
Sorry, I think I lost you. Commitment to systemic change. Yes, sorry. Sorry,
Yes.
I think I was disconnected.
Commitment to systemic change.
Systemic change. All right. Yes. We commit to advocating for policies and institutional cultures that eliminate gender bias, promote equity in leadership and research opportunities, and recognize the full contributions of women in healthcare. We commit to ensuring an equitable access to professional development opportunities for women in healthcare, and we commit to putting in place policies where they are non-existent and improving practice and implementation of policies where they exist.
What we are
Back to
supposed
you,
to
Shiv.
Yeah, so I think that's the pledge, and we have more people. I think we have hands raised. Dr. Meg, please go ahead.
No, I was just asking how to take the place. Should we repeat it or what should we do?
So yes, so Dr. Meg, what we did is this time we are not repeating the pledge, but we'll be sharing this pledge with all of you. It's an evolving pledge, but it's a set of 5 ideas that we have discussed as the Gender Equity Task Force, and but we'll be building upon this. It's not a one-time commitment, and we also have upcoming webinars, which I think you'll hear about very soon. Here will be sharing those at a later date as well. And we also didn't think about it as a very rigorous kind of something that is cast in stone. It is something that we will keep on improvising as the time progresses. So we didn't want you to like repeat the pledge, but at the time relate to the idea what we are thinking about doing over the next couple of months. So yeah, that's there. And Dr. Christine, I saw your hand up a while ago, so I'm not sure if you wanted to speak.
No, thanks.
All right. Yeah. Okay. Okay. So I think we've yeah. Please go ahead, Dr. Christine. I'm not sure if you want to speak something.
Don't think.
Sorry, I think my network is not now stable. Sorry about that. I just wanted to say at the tail end of my conversation, I wanted that to talk about the gender equity and the monitoring that we need to do at the boardroom, looking at those gender transformative implementation framework that signing the global policies that we sign. I think it is something that we need to track and digital tools become very handy for tracking. And apart from taking caution that they may leave a segment of some women behind, push them more behind, we just need to get women in STEM and women to focus on digital innovation and AI so that they become tools that we can use to leverage and to bring evidence into the room. Thank you very much.
It is true. It is true, Dr. Christine, and thanks for sharing that. I think I'll go ahead and thank Shia, Alileta, and Lekha for taking us through that pledge. And with this, we've also come to the end of today's session. I want to request our chair of associate members, Julie Beckey, to give her concluding remarks.
Thank you, Shiv. Thank you all who attended this panel. Thank you all to all the speakers who came to speak here and give their answers to these very important questions that were raised today. I leave this session inspired, both inspired by the incredible input and insight that we received from all the speakers, from all these important international organizations, national organizations. And I also leave inspired by the JDNs and their input and effort to tackle this very important and very timely question that affects not only all the women physicians, but also all the men physicians, and most importantly, all the patients that we treat on an everyday basis. So I would like to leave you with this, thanking you for the input and the discussion that not only benefit us, but the whole healthcare system in the end.
Okay.
Thanks, Julie. And I want to formally thank all of our panelists who joined us today and who made this inaugural panel of the World Medical Association Junior Doctors Network Gender Equity Task Force worthwhile. I want to extend my gratitude to my fellow task force members, Hia, Alanita, Lekha, Sazi, and Pablo, who was instrumental in running the show today. Pablo couldn't join us, but he has been here coordinating, organizing this with us. I want to also thank our digital partner, Clarinet, for setting up this session, coordination, and for facilitating the platform. And a large shout out to all our attendees who've been attending this session live. And sorry to the attendees because we couldn't take a lot of your questions. We had about 12 or 15 questions lined up, but in the interest of time, we couldn't do so. But thanks to you who made this session truly fruitful. I thank the communications director of JDN, Mauricio, and other management team members of the WMA JDN for the constant support throughout the planning of this event. Thank you, everyone. I'll now hand it over to Trishna for closing the meeting, please. And thank you all for joining today.
Thank you so much.
Thank you.
On behalf of Clarinet, it has been a privilege to host this special International Women's Day discussion, and I would like to extend my heartfelt gratitude to the World Medical Association, Junior Doctors Network Gender Equity Task Force panel for leading such an important and meaningful discussion today. And I would also like to conclude with a simple yet powerful thought that empowered women empowered the world. So wishing everyone a meaningful International Women's Day and have a wonderful time ahead. Thank you so much for joining in. Have a great time ahead. Thank you so much.
Good night.
Thank you.
Thank you, everyone. Bye-bye.